wasn't quite ready to go on the journey of a training program yet, because I felt that I needed to be 100% sure to get on that training program and feel like I was going to get the most out of it and was going to give that role justice.
Welcome to the Life As podcast, a series of conversations with inspiring people about what life is like in a number of roles you can do before or during cardiology training. I'm your host, Jonathan Bray, and over the next couple of months, we're going to bring you weekly, concise and insightful discussions. On behalf of the British Junior Cardiologists Association Starter, we're really excited to bring you this series. Today, I'm delighted to be joined by Dan Phillips, a former Cardiology Clinical Teaching Fellow at the University Hospital of Wales. Would you mind sharing your reasoning behind becoming a Junior Clinical Teaching Fellow in cardiology?
Thanks, Johnny, and thanks to the BGCA for having me today. So, Johnny, the reason for me choosing the role of being a Junior Clinical Teaching Fellow in cardiology really occurred at the end of F2, to be honest. And I was at that crossroads in my training career where I'd finished F2, and you had to make that big decision on the journey I want to take for the next stage of my training. And I was probably around 80 to 90% sure that I wanted to go towards the medical route. I previously had ambitions in the roles of surgery and trauma and orthopedics, but through my enjoyment of cardiology as an F1 and subsequent experience in other specialties like emergency medicine, I was very much in the thought process of that. I think cardiology is something I wanted to get more experience in. And I also wasn't quite ready to go on the journey of a training program yet, because I felt that I needed to be 100% sure to get on that training program and feel like I was going to get the most out of it and was going to give that role justice. And for a lot of people, that F3 year is a year of either discovering travel or discovering other specialties they haven't done yet. But for me, it was a chance to really certify my interest in one specialty at the time, and cardiology was something that I really enjoyed. So there was a job available in UHW, University Hospital of Wales, which was this teaching fellow role where I had the opportunity to do 50-50 in terms of clinical work and teaching work, and a bit of academics as well. It seemed like the right fit for me, and it allowed me to be a teacher, clinical teacher in Cardiff University, and also allowed me to work clinically in a tertiary cardiology unit. So it seemed like the right fit, and it allowed me to really make that decision going forward in my next few years and the next few steps, what was right for me and the right journey path for me going forward in my career.
What was your work-life balance like?
So my work-life balance was very good, and I feel that this is something that people after F1 and F2 are quite keen to almost protect. I feel Absolutely. That especially coming out of COVID first wave, there was these new rotas, these sort of redeployment rotas that a lot of F2s were brought into, and a lot of people felt like I wanted to do something with a little bit more freedom and allowed to have more time to enjoy things outside of medicine, because we're coming into that kind of strange period of time where there's this eat out to help out, and a lot of people wanted to go out, see family, and maybe even start to travel again. So this job allowed me to have every weekend off. I needed to, for example, do work towards exams or towards educational purposes. In my case, I was doing a master's at the time. And also it would allow you to attend things like conferences, mainly virtual at the time. So there was no real commitment to night shifts or on calls, but these were available if so necessarily pleased to add to experience. So for example, I did the addition of a few cardiology specific on calls and a few medical on calls just to maintain some experience on that acute scenario when you're working with your on-call registrar and consultants. So you'll still building your competencies towards a training program. However, for example, if you wanted to take the breaks back a bit and wanted to work towards just the teaching role of working with students at Cardiff University and work towards the clinical roles 9 to 5, Monday to Friday, you had that freedom of doing so, and you were relatively supernumerary, so leave was also easier to obtain compared to your normal 4 monthly rolling jobs or your 6 monthly rolling jobs. So for work-life balance and having a 12-month post where you were guaranteed employment, it was a really nice job to have. And also, when you talk about work side of things, it was a very good job to add to the CV for experience, both for education, clinical and academic, but also the balance that, you weren't committed to a very hard and in some cases quite tedious on-calls you can have in some jobs. So it was a nice balance, and I really enjoyed it. And I could add in more on-calls if I needed to, and also there's a sense that if you wanted to help out some colleagues with some gaps, and you could, and there was a nice element of flexibility to the role.
Yeah, well, I mean, when I saw you around, you looked like you were having a fun time, and you always had nice things to say about what you were doing. People applying for JCF posts often worry about ending up in a service provision role. Have you had the opportunity to do quality improvement, and can you tell us a little bit more about your teaching role?
Yeah, so I think absolutely. I think a lot of the traditional locum F3 jobs, you will be in a role where there is a huge expectation to fill the service gaps, and that's where you get that additional locum pay to fulfill these jobs which may not be kind of fulfilled on the rota by trainees or foundation trainees. So my job was very much protected in the sense that 50% of my time was for teaching. So I was teaching the first years to fifth years at Cardiff University, doing various different teaching roles, whether that be simulation or lecture-based teaching or ward-based and bedside teaching, and various other teaching towards trainees from foundation year trainees to internal medical medicine trainees. So that was very much protected. So you weren't doing any kind of service-based work in that period of time. It was very much protected for teaching. And then you have the ability then to have your kind of SBA time as well. So you were allowed to work towards, for example, my master's, or work towards MRCP, or have time to do various projects. And the real strength of UHW in the cardiology department is it's a very academic department with a lot of highly regarded, well-renowned researchers. So there were a lot of ongoing projects and a lot of ongoing exciting developments in that department. So there was never a period of time where you thought there's nothing to do. There was plenty of projects to be involved with, and plenty of time and plenty of support, to be honest. And we had a great supervisor in Dr. Abbas Saidi, who was really he's always been a very, very good mentor for myself, and I really enjoyed working with him and being a junior under him. So a fantastic opportunity, and there was never really a service provision role to it. The clinical side, working in a tertiary centre in cardiology in Cardiff is fantastic. The patients you see, they're all interesting. They all have their own story. So you're not fulfilling gaps which no one can fill. You're adding to a rota which is relatively well staffed, seeing interesting patients in a specialty that I was really excited to be a part of.
One of the things that might motivate people in applying for JCF posts is the opportunity to work somewhere where they envisage their long-term training taking place. How useful do you think this is?
Yeah, so I think for me, I felt going into this role that I really loved the idea of seeing how cardiology was for a internal medical trainee, but also how it would look, and looking at how the registrars worked in the department. And is this for me? And my experience was really good. Being there for a year in the same department allowed me to develop good relationships with the staff, and my seniors, and I had the opportunity to attend a FICE course, and I had some really good mentorship with developing some echo skills, and I had the opportunity to attend the cath lab and see plenty of procedures done, so plenty of PCI, plenty of TAVI cases, got to see some PFO cases. Also attended the EP lab and pacing labs as well. So really developed what future cardiology would be down the line if I ever get that far. So that was a fantastic part of the job. Now, the other thing as well is you develop good relationships with the team around. So if there's a project you want to do, these projects can be quite difficult in 4-month posts, 6-month posts. So a 12-month post allowed me to work towards publications, help me work towards projects in my masters in the department, and also helped add towards things like quality improvement as well. So it allows you to have those cycles of change and working around the different viewpoints from different people over a 12-month period. So to summarize everything that you said, Johnny, I think a longer post in the same place allows you to see, number one, how a registrar's day-to-day life is. You don't tend to really get too much involved in their day-to-day lives as a junior, as a F1 or a SHO. But being there for a year, you get to know them a bit more personally, and they can give you a lot of hints and tips going forward and advice for your training. So it was really invaluable to go through that process, really.
Yeah, absolutely. And you get the opportunity to do things after work that's really you wouldn't have had otherwise.
Absolutely. I mean, as you said, Johnny, because you now become a more of a recognised face in the department, the opportunities, as you say, to go in to see interesting cases, complex PCI, TAVIs. I know that they're doing mitral clips now in that department, and they were doing catheter-based treatments for pulmonary embolism cases. So that was really an amazing learning experience, and the physiology behind some of these treatments and the instant benefit from your TAVI patients to your catheter-based treatments for some of the PE patients. Some of the stuff that really inspires you to really kick on with your interest. And for me, I'm 100% want to become a cardiologist now. I mean, it was a fantastic year for me, and it's really also light the fire of interest. I'm now 100% behind my IMT training. I think I've got into it at the right time, and having that time to go through a medical job, and before going into IMT, it's made me think, what, this is definitely what I want to do. I'm going to put that commitment in for the next 3 years. So far, 6 months into IMT, and I'm still feeling very positive about my training, and I've my first rotation's gone well, and I've been able to meet my competencies, and you want to get up every day and work and learn more. So it was a very, very good experience for me, and I would highly recommend it.
Yeah. Brilliant. So to end on one final question, what would be your number one piece of advice for someone considering applying for this role?
So my number one piece of advice would be to be able to commit to the role. If you take a job in one of these jobs, like a teaching fellow or a junior clinical fellow, make sure you can really commit to that job, and make sure that you have 100% buy-in to that role. Departments want people that are going to give to the role and will add to the role and add to the department. Like anything, a lot of people now coming out of F2 may want to break, and if that's the case and you have the finances to it, then maybe some people want to have time away and go travel, or maybe people want to locum to add to financial benefits. But for career-based development, and there's a specialty that you've never done, or there is a specialty that you really want to do, and you've got that internal task-orientated interest, then you are going to add more to that role than if, say, I don't mind giving that a go, because it is a 12-month post. You are going to have to do the classic SHO jobs, and you're going to have to have some knowledge behind the treatment guidelines. So if you turn up to the job and you're not 100% with it, and you just want to fill your time with it, you may add to the frustration, because some of these posts are competitive, and you may after 3 or 4 months I wish I went traveling or so on, or I wish I just locumed and made more money doing the same thing somewhere else. So for me, I never felt that way. I wanted this job. I could have done a job where maybe I got paid more or had more of a sort of holiday-based year, but for me, none of that was what I wanted. I wanted to really get into the cardiology, really wanted to teach and give back to my old university, Cardiff University, and to teach the medical students. So my number one piece of advice is, if you're not 100% committed, you haven't got buy into a role, don't necessarily just apply for the job because you feel like you need to be doing something. Do a job because you think it's going to add to your sense of either experience or well-being or an interest. And there are so many opportunities like the BGCA, teaching opportunities, projects that will just enlighten that year and make it a really good year outside of the traditional training pathway.
Yeah.